Well, hello, everybody. Thank you, my friends, for the invitation to participate in this important meeting. It will be a pleasure to talk about today the Pectus carinatum dynamic compressor treatment. Specifically, I will try to put emphasis on the significance of the pressure measurement during the treatment of Pectus carinatum. This story of how we developed this device started in 1999 when Dr. Freire, my partner, we visited Dr. Nas at Norfolk, USA, to learn the Nas technique. We worked in a very big children's hospital. It's 500 beds. It's public in Buenos Aires, Argentina. So we learned that the thorax was elastic. So when we came back, we thought that probably we could use this same paradigm shift to treat our carinatum patients. And remember, we are in a public hospital with a lot of children. We are trying to fix these patients with their hands, and to our surprise, the patients get well. They get treated. It doesn't hurt. The only problem is that we needed to keep that pressure for a long time. So we decided to try to invent some kind of device that will compress the chest wall. So we knocked the door of our orthopedic doctors that are across the aisle in the outpatient clinic, and they came up with all these models that we tried in our patients for 1 year. Remember, we have a lot of patients, but they didn't work as we expected. We thought that there was something not working efficiently, and so we started to think with Dr. Freire what would be the problem, and we realized two things. First, that the patient's chest changed during the treatment. So we had to do something that would be adjustable to the size, to the width, and to the flatness of the chest. So we came up with these prototypes to assemble little pieces of brace. So we also realized that we had to reshape the chest wall so it would get flatter and it will get wider. Then we realized that the patients were different in elasticity. Some patients were very soft, as you can see from the left, and some patients were very stiff. And remember that the skin is there, and when we applied pressure, we could have some kind of skin ulceration. So we decided to measure two kinds of pressures. First, with these crazy devices that we started to develop with the help of an engineer who was a friend of us, we started to measure different pressures that we call initial correction pressure. That would be the flexibility of the chest without treatment, no, just the flexibility of the chest. We came up with the idea to measure PSI, that is pounds per square inch. That was good because all the patients were in the range of 0 to 10. So we could measure all the patients from 0 to 10. Then we decided to measure the pressure of treatment, the pressure that you apply with the brace to the skin of the patient. And in this case, this was our first prototype where we could measure this pressure. And the good thing is that we could measure this pressure. The bad thing is that we needed some batteries and electronics inside of the brace, and we didn't like that. So we decided to take out all the electronics from the brace and design a docking system where we could attach the pressure measuring device to the brace plate in order to measure the pressure without having batteries and electronics in the patient. So this is what we came up after working a lot of time with our engineers. We have a pressure measuring device that will help us to measure the pressure of initial correction. As you can see here, it's around 30. The patient is breathing, so the device will measure an average of a couple of seconds, how much pressure goes up and down. In this case, it's 3. And then we could attach this pressure measuring device to the brace, lock the brace, and now the patient is breathing. Again, we measure the pressure of treatment. And in this case, after measuring for 5 or 10 seconds, we measure the average, and it will give us less than 1. So in this case, it's 0.74. So we call it a system, actually, because it's a real system. It's not just a brace, because you need different things to make it work. You need a pressure measuring device, a docking system. You need measuring tools, and you need bending tools to make it work. So in 2008, we published our experience with 208 patients, and we learned from the investigation of this paper. And at that time, we thought that patients with more than 9 psi of pressure of initial correction were not candidates for treatment. Today, we treat patients up to 14 psi. But this is what we published. And also, we realized that we needed a gradual pressure time protocol that I will explain later. Also, we realized that during this investigation that if we put pressure of treatment higher than 2.5 psi, it was easier to get skin lesions. So we avoid to go higher pressures than 2.5 when we treat the patient. So pressure of treatment always has to be equal or less than 2.5 psi. We learned from our investigations that we could divide in 3 groups the patients: the softer with less than 2.5 psi, intermediate from 2.5 to 5, and the stiffer patients more than 5 psi. But we realized that we could predict the duration of treatment. For example, a patient in group 1 would be treated in less than 6 months. A patient in group 2 could be treated in around 6 months, but less than 1 year. And a patient of group 3 would need 1 year or more to be treated. This was good when we had to talk to the patient's family. You know, here pressure is crucial because you can tell them, okay, your patient is soft, it will be treated faster. So then over the years, learning from different doctors around the world that started to use our brace, we came up with this very efficient protocol. Because why? If a patient is very stiff, like in group 4, if we put a lot of pressure of treatment and we tell him to use all the time during the day and the night, we will make an ulceration. So we learned that stiff patients need to start with low pressures and low time. For example, patient on group 4, we will tell them just use it 1 psi of pressure of treatment, and just use it 3 hours to 6 hours a day maximum. Then they come in 1 or 2 months. If they are already more elastic, that most of them are, if they're in group 3, we can tell them, okay, we will raise a little bit more the pressure to 1.5, and you can use it more hours, 6 to 12 hours. Then they come back in a couple of months and they're softer. And now, if they're in group 2, we tell them, okay, now we can raise the pressure to 2 psi, and you can use it from 12 to 24 hours. And when they are more elastic in group 1, we tell them to use it all day and all night, and we apply maximum pressure that is 2.5 psi. So whenever the patient comes in one group, we can start with this protocol and makes the treatment more efficient, and a lot of patients will tolerate more the treatment, will give more compliance and less abandon of treatment. Example of different flexibility: a patient in group 1 that is very soft, it will be treated very fast in 3 months, as you can see here. A patient in group 2 from 2.5 to 5 psi, in 1 month she gets better, as you can see here, but it will take 3 months to get perfectly well. As you can see here, it's not only that it's flattened, but you can see her chest wall is more wide, and now even her shoulders are in better shape because we are reshaping the whole chest wall, not just the little point here in the front. So it took, like, when you start weaning, it will take like 2 or 3 more months. So in the end, this girl will be treated in 6 months. A patient in group 3, that will take us almost 6 to 7 months to put it to flat. Sometimes then you will have to start the weaning, and then it will take around 1 year because they're more stiff. Now, it was a game changer because we were just Argentine doctors working in Buenos Aires, and we didn't care about what was going on all around us. But Dr. Nas and Dr. Kelly listened to our presentation in a world meeting, and Dr. Nas came and said, we are very interested in trying your device. We said, we can't send it, we don't know how to do it unless you come to visit us. And they came to visit us to Argentina, and they spent a week. Dr. Kelly here, he learned, he stayed, he talked to the patients, and when he went back, he said, we would like to try the brace. So this was a huge challenge for us. It took us a lot of effort and investment. We had to brand it, patent it, and most difficult to have the FDA. And they help us to go through all these difficult things. Also, we had to make a more efficient and more well-made brace that we could export it to the United States. And so this also was a big challenge for us. And thanks God we were helped, and we could go through all this challenge. So we also realized that we had to prepare special forms where the doctors could put all the numbers and the measurements, because we didn't have we didn't want to send braces to another country and then the patients will not fit. So we had to prepare a systematization of how to measure and how to assemble the brace and send it to the United States. And that was a big challenge too, and it went very well thanks to all the support. In January 2009, 10 years after we visited to learn from them, we went and were blessed by being able to teach them how to use the FMF. This was the first patient ever treated outside of Argentina in the Norfolk Children's Hospital in the United States. Of course, in their hands, this became very efficient because they know how to work efficiently. We learned from them how to organize a Pectus clinic that we didn't know because we were not organized like this. So they will put all the patients all together. You see there in 10 minutes, they will see each patient, and all the nurses were assembling the braces, and we learned from them. We also learned from them how to measure them better. And also we learned over the years, we came up with this very good way of measuring that, as you can see in the bottom, the 3D scanner. There's a perfect way of measuring that will avoid any error in the manual measurement. What is a 3D scanner? Well, it's a way of taking like a 3D picture, and this is very fast. You can do it in 20 seconds. The beauty of this is that we can send it to a specific software that we developed, and this software will give us the perfect manufacturing plan, but also will give us all the information that the software will process to make a plan, to make a 3D print of the patient that we could try to see if it fits well, to avoid any kind of problem, and the pressure will be perfect when it arrives. And in case we need, in very difficult patients, we can print the whole chest. Sometimes we need very difficult to perform braces because patients are very different, all different. But the best thing is that we can use this software to make a comparison between different reports, so we can see the evolution of the treatment. And as you can see here, the software will give us all the measurements we want and a lot of indexes that we can then compare and know with objective numbers and data how the patient is going. As you can see here, we can stack 3 different scans in one report, and it will give us the exact evolution of the shape of the chest with all the measurements that will help us to compare and for publications. In the year 2013, in Norfolk, they published their first experience, and this was a very important paper for us because their results validated our results in Argentina. And this is good because we realized that we were not biased, that our numbers were true. And so in their hands, this became more efficient. They had even better results than we did. And they came up with this beautiful algorithm using pressure. So they will use the pressure of the patients to classify them to see what kind of treatment they will give to the patient. And this we learn from them too. So pressure, again, here is very important to classify patients. As doctors went to Norfolk to learn, they saw this center of excellence treating patients with our device. They wanted the device in their countries, and that was a huge challenge for us too. And thanks God we could solve this challenge and send braces to all of our friends all over the world, as happens with Vladimir, that he could treat his patients with our device. And for us, it was a big effort, but it was a big joy to be able to do all this. As example, in Denver, Dr. Rothenberg, Manuel Lopez in Saint-Étienne, France, Dr. Whit Holcomb in Kansas City, and Dr. Sherif Emile in Canada and Montreal, and many other places where they started to use the brace. We started to learn from these centers of excellence, from their feedback. Overall, over the last 20 years, all these centers of excellence started to publish their numbers, and of course, they started to validate our results. And they gathered between many of these papers more than 1,000 published individual cases. So the F-dynamic compressor system became an international recognized device with all these centers of excellence. In the year, just making this more objective, what I'm saying, in the year 2018, Dr. De Beer from Amsterdam published a systematic review in the Seminars of Pediatric Surgery. He gathered 1,185 patients published by different places, and they came to the conclusion that it is a safe and effective treatment with low complication rate, with higher success rate than conventional braces, with high compliance rate, with low discomfort, low discontinuation rate, and an advantage in assess the chest flexibility was very important. Recently, this year, this paper published by the same group is called Improving Quality of Life with Dynamic Compressor Bracing in Patients with Pectus carinatum. This is a very important page, a very well-designed paper, because it's a prospective study done between 2013 and 2016 with 225 cases. Remember that this is so difficult to demonstrate things, because normal braces without pressure will work, but how can we show that this may be more efficient or not? Well, they came up with this single institution, all these patients from the same institution, Amsterdam University Hospital. They passed all these patients by 5 quality of life scores and questionnaires that are universally standardized. Also, they use this algorithm with pressure to classify the patients that were going to be treated or not. For them, the limit is 10 psi. And this is more or less the overall numbers of their work. To our surprise, they have a 78.2% of successful treatment in these patients. And here you can see the all those 5 scores with all the different sub-scores. And they would ask to these patients all the scores at 1 month, 6 months, 12 months, 18 months of treatment, and 24 up to 2 years, they would repeat the score. And what they saw is that all these scores of quality of life and better well-being for all the patients were all better as the months passed by. They were all improving and improving and improving. So overall, this paper came to the conclusion that they had a 78.2 successful treatment rate, with 94.9 satisfaction with this treatment. Most of the patients have improvement of the self-esteem. Most of the patients have improvement with pain relief and improvement with physical complaints. And when asked if they would use the same treatment again, 87.2% of the patients would choose the FMF system again to be treated with the same way. Again, very recently, a couple of weeks ago, this paper was released by a group of doctors from the Chest Wall International Group, from different countries and different centers. They did a survey between a lot of surgeons of the Chest Wall International Group that are all experts in treating these patients all around the world. They overall gathered 4,750 patients from 44 international Pectus centers. This is a survey with 22 countries involved in 5 continents, with 80% university hospitals, and they were comparing conventional braces versus FMF dynamic compressor brace. So there were 59% of the centers were using conventional braces, and 41% were using the FMF. And this is the conclusions the results they found, that the overall duration of the compressing orthotic at any time, 9 months, 12 months, was shorter with the FMF. And the overall duration of treatment, comparing the conventional braces in blue with the FMF in red, as you can see there, is shorter with the FMF. The patients get treated faster. Also, the patients treated with FMF, here you can see in red, are more compliant. This graph is showing the non-compliance. So patients are using a pressure measuring monitored brace gives more compliance to the patient. Overall, the results of this, the conclusion of this paper is that the FMF dynamic compressor showed, compared with other braces, shorter duration of treatment, higher real wearing time, better compliance, and faster response. So in our team today, what are we doing? Well, for us, when we have a patient with a Pectus carinatum, the FMF dynamic compressor is the first choice, is the treatment of choice for most of our Carinatum patients. More than 90% of our patients get cured and treated with this device. Of course, we are surgeons and we like to do surgeries, but nowadays, rarely we have patients with Carinatum to do surgeries. Which patients we take into the operating room? Well, surgery is indicated just to patients that have rigid chest wall with a PSI over 14 when they're very stiff. So if it's over 14, we will advise them not to use the brace. If they don't want to get surgery, maybe we can try it, but we will tell them, we will strongly advise them to go to surgery. Then patients with pre-existent skin disorders, we treat them with surgery. And patients that have pain, this is very rare, but some patients will have pain while bracing. In these cases, we advise to go to surgery too. And of course, complex mixed cases that are carinatum and excavatum, when if you compress, the excavatum gets worse. And we had some patients that could even have more cardiac compression. So in these cases, we contraindicate the brace and we go directly to surgery. So this is what our team does today. This is our team in Buenos Aires. We invite you to come to visit us whenever you want. It's very nice. We work as a team. And of course, it was a pleasure to present all this data with you. Thank you again for the invitation and hope to see you soon in a chest wall meeting. Thank you very much.